Hi friends, welcome to Smile Nursing tutorial. Last time we have discussed about the stages of labor pains. Some of our subscribers and viewers asked to upload the reflexes of the neonate, phototherapy, cesarean section, trolley. So as per their wish, I will upload videos one by one as soon as possible. Okay, today we are going to speak about the neonatal reflexes. First, what reflexes should be present in a newborn? That everybody knows very well, but again once we will remain one by one. Rooting, sucking, gag reflex, extrusion, anning, grasp reflex, Morose Reflex, startle reflex, tonic neck reflex, grasp reflex, plantar grasp and doll's eye. See, these reflexes are present in a newborn. What are the advantages of reflexes to the newborn? See, the reflexes are involuntary movements or actions. Some movements are spontaneous as a part of the baby's usual activity. So, reflexes help and identify normal brain and nerve activity. For this reason, the reflexes will help to the newborn. Coming to the reflexes, one by one we will come to know. First, rooting. See how to check rooting. When the cheek is touched along the side of the mouth, the neonate will turn his head to that side. That is called rooting reflex. Next, sucking. The neonate sucks when its mouth comes in contact with a nipple or may occur as a part of rooting response. Next, gag reflex that everybody knows. In this gag reflex, stimulation of posterior pharynx by foot section or while passing tube causes the neonate to gag. This is called the gag reflex. Coming to the extrusion, in this, when tongue is touched or depressed, the neonate resists by forcing it outward. Coming to the anning, it is a spontaneous response to decreased oxygen level by increasing inspired air. Coming to the grasp reflexes, touching palm or sole of feet near the base of digits causes the flexion of hands and toes to the newborn. Morose reflex, this is also very easily we can identify in the neonate. In this, sudden lack of support causes the children extension and abduction of extremities, fanning of fingers and bringing them arms together in the midline. So, because of this, neonate may be crying, extension of head and trunk. So, these are present in the Morose reflex. Next, startle reflex. A sudden loud noise causes abduction of the arms with flexion of elbows, hands remain clenched. Next, tonic neck reflex. In this, turning the head passively 90 degree, the flexion of the opposite extremities occurs on the side to which the neonate is facing. Next, grasp reflex. The grasp reflexes can be identified by placing a finger in the palm of the neonate's hand. So, the neonate responds by grasping the finger can be partially be lifted by this grasp. Next, plantar grasp. The plantar grasp is identified by gently pressing the thumb into the sole of the feet. So, this produces flexion of the toes. Last one is doll's eye. Head is moved to the right or left. Eyes lag behind and not. Today we have discussed about the reflexes of the newborn and its advantages. If anybody not subscribed, you can subscribe this channel for new updates. Next we'll meet with the phototherapy subject. Thank you for watching this video.